Today, 2 out of every 3 people who are diagnosed with cancer survive the disease. But although they're breathing, many of them are not actually living. They're unable to return to work, pay their bills, or sometimes even play with their children. And the reason is chronic fatigue. It's the biggest single challenge faced by the exploding number of cancer survivors today. Millions of them are struggling to climb back, but now there could be an answer.
There's a lot of reward when you talk to the people who've been in the study and are engaged in then the next phase after the first 12 weeks, that they are noticing a difference in their life and how they go about their daily activity. And when they first come into the study and we say, describe what your life is like right now. And they describe how they get out of bed but they're tired and they're able to go through part of the day and then have a rest, and you're just trying to, in a way, just go from day to day and just survive in a way. And then to see these people after only 12 weeks of actual, what most would consider to be minimal physical activity, and the impact that that can have, to me, is amazing.
I've been impressed by the significance of the results, effects on both the fatigue and the, if you like, psychological functioning, the mood and so on, is perhaps rather more than one might have hoped for.
And when you look at the data, it's stunning. I mean, we've seen people come back to levels of energy that are similar to the general population.
It was very hard for me to live with the fatigue, and so I would have done anything to get rid of the fatigue.
Well, when I first came out of the Tom Baker, I'd say I was, on a scale of 1 to 10, would certainly be a 1, and I stayed that way for a very long time. Very long time. And when I initially started the program, I thought I'd made some recovery, possibly to 3 at best. And after 10 months of this program, I'd say I'm pretty close to a 7.
Fatigue is a side effect of almost every known chemotherapy, radiation therapy, almost all cancer treatments.
The study includes people from all walks of life. We have firefighters, we have speakers like myself, we have homemakers, we have veterinarians, we have college professors, and everyone along the spectrum. So people who have not exercised before in their life, people who have exercised before in their life. And the really neat part is that it is positively affecting all of them. All of them, not just a small little segment. It has everything to do with what we see happening when you look into the eyes of a person and you give them hope.
One would not have expected to see these sorts of changes. In other words, this intervention has made a difference to these people. And the thing that still impresses me is how dramatic that improvement is in some of these patients, how quickly it takes place, and how it takes place with, if you like, relatively gentle intervention.
And we have a person who's at death's door. They have gone through a transplant situation with the medical profession who are unbelievable in terms of what they've been able to do in saving that person's life. And yet, as a result of that, they still have this fatigue. Coping with life, doing normal things is difficult. And then we come along and we say, you know what we're going to do? We're just going to do a tiny, tiny little bit of exercise. Because we think that actually doing that, what we would call aerobic exercise, using oxygen, is actually going to enhance your ability to handle fatigue.
I started the bike, and quite quickly after I started that, my energy started to pick up. And usually in the winter time, from October, the end of October through to February, March, I would spend at least 3 blocks where I would get sick because I'm immune suppressed, and I would get hit hard where I would be in bed for 3 days I'd lose anywhere from 5 to 10 pounds easily in a shot every time I got sick. And when I started the bike program in September through till March or April, I did not get sick once.
So certainly the program needs to be known, I think, more broadly, and hopefully attract some funding in terms of being able to allow more candidates to come in and participate.
The gains to be made in the longer term, in all sorts of respects, in terms of the quality of life of the patients, in terms of their ability to contribute again to society, in terms of actually getting some patients off the insurance support, for example, that they've been covered by all these years. It's a win-win situation, really. In other words, if you look at it in any of those terms, it's a relatively small investment for quite substantial returns down the road.
Well, when you think about the monetary side of it, for sure, because people who have this fatigue, they're going to make many, many more visits back to the cancer center. They're going to go to their GPs, they're going to see their psychologists because they're distressed and they're looking for some kind of answer. So all that costs the system a great deal of money.
What I would like to see is that we're able to convince investors that they could donate, that all these cancer people, breast cancer, any type of cancer, they could come and have as a unique focus to then restore their energy, and that there are people out there who want to help them, and that they can be helped, and they just have to then focus in on doing the work. Because I also believe that it's not only doing the physical work that is important, it's the support network that people provide to them and the encouragement that they can then give them to do and maintain their exercise program.
This program is one of the first programs of a new foundation we're forming called the Climb Back from Cancer Foundation. And the objective of this foundation is to deliver services that will maximize the chances of the individual not only surviving cancer, but thriving beyond it. Now, we are in essence at the base of a huge global mountain. I mean, this study starts here, but will clearly it has the potential to go worldwide.
I've got my life back to what it was prior to the transplant, and I can do whatever I want to do, whatever I set my mind on doing, whatever goal I want to attain.
The feeling afterwards of like a real relaxed, sort of pleasant feeling, and sleeping better, and I just wake up just feeling fit. And I attribute that really to this program.
I just feel very blessed that I've been a part of this. I mean, it really has made a difference in so many aspects of my life. That the people who initiated the study, the people who continue to sponsor it, and I mean, there's always difficulties finding funding for many competing studies and efforts. But I think this one is very important in helping people.
And what we're talking about here goes far beyond a simple medical study or a charitable foundation. What we're talking about here is hope. It's about lighting a candle in the darkness. It's giving people a reason and a desire to live. You know, tragedy can be teacher. Medicine can work miracles, but only hope can sustain life.